let's look at some side effects that can happen from cannabis use, both THC and CBD. So first of all, let's just clear up one of these myths here. It used to be thought that the bigger and heavier a person was, and if they were male, that they weren't as affected by THC or cannabis use as, say, someone who is smaller, more petite, or female. That is not true. So we're starting to understand that genetics has a lot to do with how somebody reacts to cannabis. So three things go into, are going to affect how effective cannabis is, especially when we're looking at THC. That's your genetic makeup, your intake method, and the product that you're using. So especially the potency of the product that you're using. So first of all, let's look at genetic predisposition. This is a fascinating area of study, and there's only a couple of companies that are starting to dive into this. So we've all heard of things like 23andMe and Ancestry that are kind of getting our DNA, and then they're telling us, if we might be susceptible to things like cancer or other big disease processes. And there's some companies that are starting to look at how genetics are affected how our cannabis use is affected by our genetics. So if cannabis is going to be effective, if there's areas that you need to be cautious of, we don't have a lot of information on this yet, and right now it's not very detailed. It's quite general, but it's kind of super fun. So there's a few companies now. This particular reference is from growthcellglobal.com. And for this is just part of a report that has come out of a person's genetics. So this is one area that they're looking at. Is this person at risk of cannabis-induced psychosis? And again, we don't really understand who is at risk of psychosis from high THC products, but we're starting to kind of gain a little bit of information around this. So this particular example in this person, their risk for cannabis-induced psychosis is actually increased. So it's not severe, but it's increased. So if somebody has this information, they know they need to be kind of cautious with their THC use because they do have this increased risk for cannabis-induced psychosis. Okay, I think I've already referred to this, that majority of side effects are reactions to THC. There are a few side effects that can happen from higher doses of CBD, but let's look at the THC side effects that can happen because THC is the most abundant cannabinoid in cannabis products, and it's also the one that causes impairment as well. So we have to be careful with that. Just know that if somebody is more susceptible to these kind of uncomfortable side effects from THC, if they take a product that has CBD in it, that can counteract or balance out the effects of the THC. And so again, this is how you can advise somebody if they're saying like, I can't do THC, it makes me too uncomfortable, then we can help them add in some CBD into that product to balance that out and see if that helps them at all. So let's look at some of the possible side effects from THC use. Now, not everyone is going to be experiencing these, and not everyone experiences them from the same product. So with some products you might experience some of these side effects, and other products you won't, and some people never experience these side effects. So first one is tachycardia. So that's when we have that elevated heart rate. So your heart just kind of feels like it's racing, kind of moving really fast. Paranoia, that's where someone who is in the same environment that they've always been in, and then they become impaired from THC, and all of a sudden every little noise and creaking of the house, they kind of go, what was that? Right? So that's and that's just a mild form of paranoia. It can get to the point where some people don't feel comfortable in public when they're impaired from THC because they just feel too exposed or too vulnerable from it. And increased anxiety kind of goes along with that as well. So we've talked about how cannabis can actually bring down anxiety, but it can also increase anxiety in some people. And this is where people will feel really uncomfortable being around other people or being in unfamiliar situations with that. Some people get quite disoriented and dizzy. There can be perceived time alterations where you think, it's only been a few minutes, but hours have gone by, or you think that hours have gone by, but it's only been a few minutes. So that kind of time disorientation can happen. Impaired motor control, where you just get quite uncoordinated. That really affects things like your ability to safely drive or safely operate machinery, or even safely if you're in charge of little ones, stuff like that. Your motor control can be quite disorienting for you. Some people experience a numbness. I've also seen people where this numbness is temporary, but I've seen it where it actually lasts for several days afterwards. So maybe numbness and tingling in the arms and hands or fingers or their toes, those kinds of things. Again, that's more rare, but it can happen. Probably the most common side effect from THC is dehydration. So red eyes, that's a little bit of a, sort of an indication that somebody is high or used a lot of THCs. Their eyes can get quite bloodshot. The eyes actually get really dry as well, dry and bloodshot. Really dry mouth, some people refer to that as cotton mouth. They can get headaches, that's from dehydration. So again, if someone is more susceptible to the drying effects or dehydration effects of THC, but that THC is really helping manage their symptoms, a great way to sort of help counteract that is to use some electrolyte drinks that can really help keep the body hydrated, so that that side effect is less pronounced. Decreased motivation. This is probably one of the things that parents complain about the most when their teenagers discover cannabis use, because they can see a marked depression in their motivation. So they don't want to go to school, they don't want to study, maybe they just want to sit and play video games all day, they don't want to interact with their friends. Again, this decreased motivation is it's a little more rare, certainly not uncommon, but it's not everybody suffers from this side effect, but this can be a tough one to manage as well. And we start to get into cannabis use disorder that we'll talk about shortly on that one. Lethargy, so just people get kind of tired and slowed down. They don't really have the energy to do anything. That's when we're using those products to help with sleep. So is that a side effect or desired effect? Well, it depends on when you're taking that and when that side effect hits you. Low blood sugar can happen for some people. Cannabis definitely stimulates the appetite, and if you kind of ignore that for too long, blood sugar can drop. Orthostatic hypotension, so that's that dizziness that somebody gets if they're sitting or lying down and they stand up really quickly. They kind of get that little kind of dizziness, disorientation that can happen. That usually comes about as either low blood sugar or the blood pressure actually drops a little bit too much there. And then when people are smoking cannabis products, of course, we have all the things that go along with that. We can have the throat irritation, coughing, those kinds of things can happen with that one. An issue called hyperemesis syndrome can happen, again, not uncommon, but fairly rare. But this is defined as severe, intractable episodes of nausea and cyclic vomiting, accompanied by abdominal pain. And again, that's just that abdominal pain from somebody needing to vomit. We know that this is, there's lots of reasons for hyperemesis syndrome. Different drugs can cause that, different medical conditions can cause that cyclical vomiting. But we know it's related to cannabis if the person is a heavy cannabis user and if they get relief from hot showers. So it sounds a little bit weird, but people who are heavy cannabis users and have this condition, they find that they get some relief by having a hot bath or even more a hot shower. So someone might be having 4 or 5 hot showers a day just to give them a little bit of relief for a few minutes from that cyclical vomiting. This can really lead, cyclical vomiting can really lead to dehydration and electrolyte imbalances that just occurs from that loss of fluids. Or if they're nauseous all the time, they're not going to feel like eating. Again, we're going to get some low blood sugar that can happen as well. Untreated, this can lead to some serious kidney issues that can happen with that one as well. Treatment for this one is abstinence from cannabis. Now, that can be problematic for people who rely on cannabis on a daily basis to treat their medical condition. So especially people with PTSD or chronic pain who find that cannabis is the best medication for them. They may get to a point where they're heavy users and they get into that cyclical vomiting. It becomes a really vicious cycle to kind of pull yourself out of. Because basically we want to get them out of, we want those receptors to reset so that they don't need as much cannabis, which can lead to the vomiting. One of the ways if you're working with someone who requires heavy dosages of cannabis on a daily basis, then we want to get them to switch products quite often, because by switching products we can maybe fool the body into not kind of building up this tolerance to it. It doesn't always work, but it might be a better solution than somebody having to face going through a few weeks or a few months of no cannabis use at all. So again, it's a little bit tricky to deal with this one, but just know that's what's going on. Of course, if you're working with someone who is experiencing that cyclical vomiting, make sure that they get checked out by a healthcare practitioner, just because it may not be due to cannabis use. There could be another underlying medical condition there that really needs to get checked out. So we know, we've talked about how cannabis can exacerbate mental health issues. It can aggravate psychosis, schizophrenia, and bipolar disease, especially in those vulnerable individuals. Again, we don't really know who's vulnerable. Genetic testing may start to give us some answers to that in the future, but right now we don't really know. Suicidal ideation or suicidal attempts, we find that especially with a lot of men, this kind of is an affliction that tend to not exclusive to men, but we do find that men have that issue. Amotivational syndrome is probably a little bit more common issue that you're going to come across. So lack of desire to complete tasks, there's sort of apathy about the future. We're not into full-blown depression at this point, maybe a little bit of mild depression in there. Unfocused, poor concentration, decreased interest in social activities. So this is where somebody, if they're using high THC products and this starts to happen, that they become really unmotivated with their life, then we can add in some CBD products and help them to maybe cut back on some of that THC, see if that helps a little bit. Or again, maybe just abstinence might be required. So cannabis can treat some mild to moderate mental health issues. It can also cause or exacerbate some mental health issues. So again, we always have to use caution, especially with new users or people who we know are suffering from mental health disorders. CBD has, I think, a big future in helping to treat some of these more common mental health disorders. But again, we don't have enough information yet. Always work with a healthcare practitioner when treating this type of issue. So just a few adverse reactions that we can have to CBD, and this usually occurs with high doses of CBD. So it can lower the appetite, which can be a good thing if somebody is on a weight loss program. But for someone who isn't on a weight loss program, it can lead to unintentional weight loss, which might not be a good thing for someone who doesn't really need to or shouldn't lose any weight. Higher doses can lower blood sugar levels, and then that can result in hypoglycemia, which is just a fancy word for low blood sugar. So things that can happen there, you can get headaches, you can get that crankiness can start to happen. You can get dizzy, disoriented, sort of unable to focus on anything. Know that CBD is not a replacement for insulin. So if somebody does have insulin dependent diabetes, we're not going to be able to manage that with CBD if they're already on insulin. Now, in the future, we may have some interesting products that come out for diabetics, but right now, please don't try and treat insulin-dependent diabetes with a CBD product because they really do need that insulin as well. CBD may help to manage out-of-control diabetes, but it's not a replacement for insulin. Again, that orthostatic hypotension, which is just when you stand up quickly from a lying down or sitting position, you can kind of get dizzy and disoriented. So that's quite temporary. That can happen if the blood pressure, CBD brings the blood pressure down a little bit too much, your blood sugar is really low. So we have to be cautious with that. Higher doses can also lead to that hypoglycemia, which is the low blood sugar as well. We can interfere with blood thinner medications on this one, and CBD can also cause insomnia. So the opposite of what we're looking for when we're treating sleep disorders with cannabis. This is likely a factor of genetics, but just in the same way that some people can have a cup of coffee with a lot of caffeine just before bed, and they sleep just fine, and other people, if they drink caffeine even just in the afternoon, they're awake for hours at a time. It really interferes with sleep. CBD can be the same thing. Now, you don't get that kind of jitteriness that you get from caffeine use, but it's more like, hey, I took CBD at dinner time and now it's midnight and I'm cleaning my house and I still have lots of energy to go mow the lawn, which the neighbors won't really like. And so why aren't I sleepy? So that's usually the CBD. Some people sleep just fine on CBD. Other people are kept awake with it. We do have some age-related concerns with cannabis use. Again, the elderly and the youth, two of our more vulnerable. Elderly might be more susceptible to falls if they're taking THC. And then again, we risk some of those unknown side effects or contraindications when we're taking it with pharmaceutical products. And often elderly people are on handfuls of pharmaceuticals, so always be careful with that. And then, of course, youth, we've been just harping on this whole course, much more susceptible to mental health issues from high THC products, especially if under the age of 25. Our brain isn't really fully developed until we're in our mid-20s. Other age-related concerns, men, especially during childbearing age, so heavy THC use can lower sperm count. And again, this may just be due to smoking, because we know that smoking cigarettes also can lower sperm count. So again, we need to be careful of that. And then women during childbearing years, there's really little, if any, evidence if cannabis helps or doesn't help or is detrimental. So again, let's err on the side of caution right now during pregnancy, lactation, or even wanting a young woman or a woman who is looking to get pregnant. We want to really cut back on that cannabis use until we have more information about it. Cannabis use disorder, it's also CUD. You may see that word in papers and books. The definition for cannabis use disorder is a similar around the world. The following is taken from the Alberta Health website. So statistics vary. So between 2 and 11% of cannabis users will develop a cannabis use disorder. So again, some people are saying is more like 8%, and is it temporary? Usually it's temporary. Is it permanent? But again, so our stats are it's quite a wide range, 2 to 11%. We'll know more as we do more studies. So Health Canada has kind of put together this list of issues where it says you may be dependent on cannabis if 2 or more of the following are true. So we'll just go through those. If you use larger amounts of the drug than you ever meant to, or you've been using it for a longer period of time than you've ever meant to. Now, if cannabis is treating your long-term health condition, or it's not treating it, it's managing your long-term health condition. And so you require it on a daily basis long-term. And if you stop that, your condition becomes uncomfortable again. Your symptoms come back. Is that a cannabis use disorder if you're using it for that? Again, so this is a little bit vague. We don't have a really good indication of what constitutes a cannabis use disorder, so we have to sort of take everything in context. If you can't cut down or control your use, I think control is the important one, especially if you're wanting to cut down on that use. Now, if you cut down on that use and your chronic pain comes back so much that it interferes in your life, then you may want to cut back on it, but then your pain comes back, so then you have to kind of weigh those options with that. You spend a lot of time getting or using the drug or recovering from the effects. So again, this is just classic addiction symptoms. So is cannabis, there's a lot of debate if cannabis use is an addiction or if it's just a temporary disorder or if it's even meaningful at all. You have a strong craving for the drug. You can no longer do your main jobs at work, school, or home. That's a pretty good indication that maybe you're taking too much or it's not the right medication to treat your health condition. You keep using it even though your drug use is hurting your relationships. You have stopped doing important activities because of your drug use. And again, a lot of these points are just general addiction issues that can happen. You use drugs in a situation where doing so is dangerous. So if you're using it and driving or working in a safety sensitive position where you can endanger both yourself and others, that's an important thing to pay attention to. You keep using it even though you know it is causing physical or psychological health issues. You need more and more of the drug to get the same effect, or you get less effect from the same amount over time, and this is called tolerance. We've reviewed what that is. And you have uncomfortable symptoms when you try and stop taking the drug. This is called withdrawal. And again, depends on what those uncomfortable symptoms are. If you're using it to treat chronic pain and you stop using the drug and your chronic pain comes back or becomes unmanageable, do you have an addiction to cannabis, or is cannabis just the best way to manage your chronic pain? Again, we have to kind of pull cannabis out of that stigma of being an addictive drug and look at it in a much more realistic way. And it's just going to take time for our lawmakers and our law enforcement people to sort of figure out that cannabis, maybe shouldn't be lumped in with all of the other addictive, dangerous drugs. And maybe we need to think about cannabis use in a different way. So physicians who are helping people with the use of cannabis for medical conditions are required to report adverse reactions that people have. And so an adverse reaction is considered serious if it requires an inpatient hospitalization, prolongs an existing hospitalization, causes congenital malformation, results in persistent or significant disability or incapacity, or is life-threatening or results in death. Again, we know that cannabis use in and of itself has never caused a death, but we don't really know what we don't know yet as far as when cannabis use being adjacent to or at the same time as other drugs. So lots that we need to learn here. That first one, it talks about requires inpatient hospitalization. There's a lot of people who think they're going to die from cannabis use if they get into that THC overwhelmed state, and they will kind of show up at emergency and they just need to sleep it off. So is that an adverse reaction or an expected reaction to someone who has taken too much THC? Not necessarily dangerous unless they try and drive, but it can be really uncomfortable for some people. I'm not sure how much of that is being reported at this time. Unless they show up at an emergency room, then it's definitely being reported. So there is a database where you can go and report these, and the link is on the form there. So again, this is mostly for physicians. Healthcare practitioners would be required to report adverse reactions, and that's actually required with all drug use. If a patient reports an adverse reaction to it, then Health Canada wants to know about that. And that can result, if enough people are complaining about a drug, this is where we will get recalls on certain drugs or even certain foods and things like that. So it is an important part of how we test different drugs and things that are on the market when they get into general use within the public. So that's a look at our side effects that can happen from cannabis use.